Hello, welcome to the webinar. My name is Joshua Music, and I will be your host for today. It looks like we have a few more people that are logging in right now, so I'm going to give it just a minute, and then we will get started. We're excited to share this webinar with you, so see you in just a moment. Welcome to the webinar. We're so glad you joined us today. Folks, today we are going to show you the easy 4-step formula you can follow to understand Medicare completely and find the very best coverage at the very best price without doing hours of research, dealing with pushy insurance agents, sorting through mountains of junk mail, and in the end being forced to just guess and hope you don't make a mistake. Because the reality is, Medicare is very confusing. There are so many options available to you that it's easy to get buried in all the complexity and confusion and end up frustrated. That's fine. Okay. Well, today I have a very special speaker who is going to cut through all that confusion and show you exactly how to get the best Medicare coverage available at the lowest price with absolutely no hassle or headache. But before I introduce him, I want to share with you 2 goals that we have for you today. The first goal is to save you time and money. The second goal is to keep you from making a mistake. You see, every day people do make mistakes. And folks, as you know, there are no do-overs in retirement. You get one shot at it. Getting great health coverage can be a huge blessing to your retirement. Just the same, getting poor health coverage could be your biggest curse. Here's the truth. Almost 100% of Medicare mistakes happen because someone tried to figure it out all on their own. So today, our goal is to keep you from making that mistake. Now, if you stay until the end, I'm going to send you a couple things. First, I'm going to send you all my slides and a recorded version of this webinar. We are recording it, so don't feel like you have to write down every single word. Okay, I need you to really pay attention and just don't get caught up writing stuff down. I will send everything to you. Secondly, I'm going to send you a guide that I wrote called The Ultimate Guide to Spending 15 Minutes Per Year to ensure you have the perfect drug plan. This is going to be a resource you're going to look back on and reference for years to come. Now, there's 2 Medicare paths available to you. Let me show you the first one. This is what I call the normal Medicare path. Here's what happens. Most people research Medicare, okay, whether that's online or by reading stuff. They end up getting confused and frustrated because there's so many options and so many rules. So they end up just enrolling in coverage, but they don't really understand it or they don't know that it's the best. But they run out of time, so they buy a plan. Well, maybe months later, maybe years later, they find out they made a mistake and they really didn't buy what they thought they were buying. And so the path continues. They start over. They research Medicare. They get confused and frustrated. They enroll in another plan and then find out later they made a mistake. I don't believe that you should have to do that. There's a better Medicare path, one that we're going to talk about today and one that I think you should be able to follow. Here's how it goes. First, enroll in a Medicare What You Must Know educational program. Now, there's all kinds of these out there, but what you're watching today qualifies as that. You need to learn from somebody who knows what they're talking about, an expert, and that's what you're going to learn from today. Secondly, you need to consult one-on-one a Medicare expert about your specific situation. You need to talk to someone who's been there and done that, someone who's helped hundreds or maybe thousands of people walk through Medicare. They're out there and you need to find somebody that can help you. Thirdly, once you've done this, you're able to enroll in coverage with confidence, and then when you go to use your plan, you're going to love it. Okay? This is the path that I think everybody should follow. Let me introduce you to our speaker today. His name is Marvin Music. He actually happens to be my father. Let me tell you a little bit about him. He has presented this webinar hundreds of times to thousands of baby boomers. He's done hundreds of live local workshops across the country. He's recorded this show for some PBS TV audiences. He's personally sat across the table, sat across the conference room from thousands of people and walked through their specific situation and helped them get great coverage. He invented something that we call the Medicare Grid, which is how we are able to get Medicare on one page and make it clear and succinct for you. He studied Medicare for, I think, around 14,000 hours. We were talking about this before the show. And guys, I don't think there's anyone here listening to this, me included, that has studied Medicare for that long. But he has, and so he knows literally almost all of it. He is the creator of the 4-step Medicare process that we are going to be teaching you today. That being said, let me introduce you to him. His name is Marvin. Welcome to the show.
Thank you, Josh. It is great to be with you and those joining in on today's webinar. Medicare is certainly a program that is confusing, it's intimidating, and at times, truly, it's just overwhelmingly complex. And unfortunately, when Medicare recipients make mistakes, those mistakes can be quite costly. That's why through the years, we've worked hard to figure out the very best way to help individuals and to help couples make the right Medicare decision for their specific situation. Now, we've done a lot of things right, but in our beginning days, it was very challenging, and honestly, we did a lot of things wrong as well. It took us a lot of time to figure out this massive government program with all of its deadlines and penalties and all the red tape. We had to learn how and when to dot all the I's and cross all the T's. And that's why I can really relate to people who are turning 65 and beyond and are thrust into the Medicare world. They are usually given very little direction, and yet they're forced to make a decision that could affect them for the rest of their lives. So let's jump right in and let's take a closer look at the critical details involved in the Medicare decision. After thousands of hours of study, we've learned that there are 3 main components involved in everyone's Medicare decision. Number 1, you will get your Medicare card using one of 2 enrollment periods. Both are simple to use. Secondly, you are only given 2 options for coverage. Number 1, original Medicare, including a supplemental plan, or number 2, a Medicare replacement plan. And last but not least, you will purchase your plans from one of 2 types of insurance agents. There is no way around this. Most people find that using the second type of agent is usually in their best interest. Now, Josh, sad to say, another discovery we've made through the years is that most people are forced to do Medicare the hard way. But fortunately, for those of you joining in on today's webinar, you don't have to be like most people. We're going to show you today how to avoid the hard way and do Medicare the easy, efficient, and enjoyable way. Let me explain what I mean by the hard way. Well, the hard way is talking to friends and others, what you're going to find is that the more you talk to other people, neighbors and family, the more confused that you're going to be. The hard way also is searching online, going through all the junk mail that you're receiving, going onto Medicare.gov. You see, folks, you got to realize that most of the articles that you're going to read online or receive in the mail have to legally cover every little situation that's available. And really, it's impossible then through all that to get clear and concise direction. Also, there's 2 million insurance agents who want to sell you something. Now, 95% of those agents care about only one thing, and that is selling you a plan and making a commission. That's how they get paid. They usually don't care about educating you. They're done and on to the next person. Their goal is to enroll you in a plan as quickly as they possibly can and then get on to the next person.
Yeah, Dad, I think the question that we're really asking folks is, hey, do you want the easy way that you can confidently choose the very best Medicare coverage? And if you say yes to that question, then you need to really pay attention to this. Because since 2009, I've watched as my dad and the experts on his team have walked thousands of people through this easy 4-step formula, and they end up with coverage that they love. In fact, I don't know that I've ever seen it not work. Real quick, before we get started, my attorneys tell me that I have to say this. I'll let you read this entirety whenever I send it to you, but let me just read the first paragraph. The information contained in this presentation is general in nature and does not take into account your personal situation. You should consider whether the information is appropriate to your needs and where appropriate, seek professional advice from an advisor. Okay, so I got to get that out of the way, but let's go ahead and jump right in. Here's what the 4-step formula is. You might grab a pen and jot this down. Step number 1, you all out there need to determine your correct enrollment period. Okay, you need to determine when you're going to enroll. Step 2, decide between original Medicare or a Medicare replacement. That's your choice. Step 3, compare drug plans using a simple process because there's probably 25 drug plans available to you. So you got to know how to compare those. And then step 4, choose someone to process all the enrollment paperwork.
Okay, Josh, so step number 1, it says determine the correct enrollment period. And the question is, why is this so important? Well, first of all, to avoid Medicare penalties. Folks, almost every part of Medicare has a potential penalty if the enrollment is not done the right way and at the right time. Secondly, this is important so that coverage will start at the perfect time. You see, you don't want delays or overlaps or gaps in your insurance coverage, and none of these will occur if you will follow our system. You need to determine the correct enrollment period for your specific situation. You see, there are actually 3 types of people that are watching this webinar today, and all of you will fall into one of these 3 categories, and you will need to make your decision accordingly. So first of all, there are those of you that are turning 65 soon, and you will be retiring soon. The second group of people are those that are already 65 or above, and you're planning to continue working. And the third group of people are those that have worked past 65 and now you're making a decision that it is time to retire. So let's look at each of these scenarios. So scenario number 1 are those turning 65 very soon and you are already retired or you know that you will be retiring in the next few months. So the question is, when should you enroll into Medicare? Well, if this is your situation, first of all, you're given what is called the initial enrollment period. The acronym is IEP. And this is used when you need to start your Medicare benefits at 65. This initial enrollment period lasts for only 7 months. So you have 7 months to sign up. That period of 7 months begins 3 months before your 65th birth month, the month you turn 65, and then 3 months after that. And we highly suggest that you enroll in advance, which means the 3 months before you turn 65, so that your coverage will begin the very first day of that month in which you turn 65. Now, this next slide is going to show you an example of someone's initial enrollment period. Again, it lasts only 7 months, and this person is someone who's turning 65 in July. And again, this is someone who needs to start Medicare in July because they have no other insurance coverage available to them. So they're going on Medicare. And so this initial enrollment period began 3 months before. That would be April, May, and June. And if you will enroll during those first 3 months, your Medicare coverage begins July the 1st. But if you delay for whatever reason or you procrastinate the enrollment, what will happen is this. If you are turning 65 in July and enroll in July, your coverage on Medicare won't start until August. If you wait until August, Medicare will not start your coverage until October. And if you wait until October, they won't start you until January the following year. So you can see what's happening. If we wait until the birth month or thereafter, then your coverage for Medicare is going to be delayed. And so that's why we encourage you, if you need to start Medicare at 65, do it the 3 months before. Now the next question is, how do you enroll into Medicare? First of all, if you're receiving a Social Security check, your card will show up in the mail automatically. Nothing you had to do, about 100 days before the month that you turn 65. That's the way the system is designed to work. Medicare knows that you're receiving retirement benefits, and they're assuming that you do not have a group plan available to you. So they mail the card to you. Now, there are times when you're receiving Social Security and the Medicare card doesn't show up. Well, problem is it could have gone to the wrong address if they don't have your up-to-date address. Could be that you could have accidentally thrown away that card. Many people do this because they get so much junk mail and they throw that Medicare card away. And so if you've done that or you cannot find the card, just simply call the national toll-free line here listed at 800-772-1213 and Medicare will send you a card within about 2 or 3 weeks. So that's for those of you that are receiving Social Security, your card should automatically arrive. Now, for those of you not receiving Social Security, what you're going to need to do is you're going to need to self-enroll. So that's those of you who have decided that you're not going to take Social Security yet, for whatever reason you're waiting, but you do want to start Medicare at 65. There are 3 ways to do this. The first one and the easiest one is to enroll online. Here's the website here, socialsecurity.gov/Medicare only. It will take you less than 10 minutes to do your enrollment in this method. If you're uncomfortable with that, you can always call the toll-free line. You'll probably have to wait an hour before you get someone, but they will certainly help you do it. Or most times you can stop by a local Social Security office. Sometimes you'll need an appointment. Other times they'll see you on the same day. But these 3 methods will get you enrolled into Medicare if you're not already receiving Social Security. And after you've done the enrollment, your card will arrive in the mail about 4 weeks after that enrollment period. Now, that's scenario number 1. Now, let's look at scenario number 2. This is for those of you that are still working. In other words, your 65th birthday is approaching, and you know that it's not yet time to retire, so you're going to plan to continue to work for some years. And so what do you need to do? Well, you may not need to do anything at all at this time, which means if you're happy with the employer plan, you like the cost of that plan, the coverage of that plan, you really don't have to do anything at this time. Now, Medicare encourages you to enroll into Part A. We want you to be aware of that. And the reason they do is because it's free. But we also want to remind you that you do not have to take Part A if you have a group employer plan available to you. In fact, if you do not take Part A or Part B or Part D because you have a group employer plan available, you will not be penalized if you decide to delay enrolling and pick up Medicare at a later date. The key is you must have insurance in place at your employer that is considered credible coverage. And if you have that in place because you're still working, again, you don't have to do anything at this particular point in time. Now, we want to remind you that if you're still going to work and you decide to go ahead and take Part A because it's free, that if you do that, you can no longer contribute to a health savings account. Some of you are going to have a high deductible insurance plan with your employer, and with that is usually attached a health savings account. And so if you are on a high deductible plan with a health savings account and you take Part A, just remember you can no longer legally contribute to that health savings account. You can keep the money, it's all yours, just no new contributions. Now, for those of you that are receiving Social Security, the Medicare card, A and B, is going to show up in the mail automatically. And if you're happy with the employer coverage that's available to you, what you can do is you can actually delay taking your Part B benefits. If you're taking Social Security, you will have to stay on Part A, but you don't have to keep Part B. And so when the card shows up and you do have a group plan available, as long as it's based upon active employment, you can send the card back in. And what you'll need to do is, as the slide shows here, you need to mark off here that I do not want medical insurance. That means you're not going to take Part B yet because of the group plan that is available. You sign the card, you send it back in, and Medicare will amend your benefits. They will send you a new card that'll say hospitalization only, Part A, and then you can pick up B whenever you lose that group employer provided plan. And so it is fine to delay that. Now that's scenario number 2. Now scenario number 3. This is for those of you that are over 65. You may be 67 or 69 or 75. And you have decided it is now time to retire and you're going to lose the group plan. So the question is, when should you enroll into Medicare? Well, you're going to come into Medicare when you lose that group plan, and you're going to come in using what is called a special enrollment period. So this special enrollment period is for those who didn't enroll at 65. Why? They didn't need to, because they or their spouse were already covered by that employer-provided plan. And now you're going to retire, and so that plan is going to be going away. It will be eliminated. And so how do you use this special enrollment period? Well, first off, you can sign up and you can start your Medicare coverage anytime that you are still working. Now, folks, it is not uncommon today for people, when they have their employer group plan open enrollment period sometime throughout the year, that the employer plan will give you their offering. They may give you 2 or 3 different options. And what we're finding more frequently now is that people are going to continue to work past 65, but they're looking at the employer option, and sometimes the premiums are much higher and the coverage is not as good as their Medicare option. And so it could be that if that's your situation, that you may even want to use Medicare while you're still working. Medicare may be a better option, may be a better price and better coverage. And so while you're still working, you can use a special enrollment period. You can say no to the employer plan, and then you can start your Medicare benefits and just continue to work. And I can assure you, your employer will shed no tears if you decide to go on Medicare. They'll be happy for someone else to be able to take care of your insurance. And so if that is your situation, what we always suggest is look at all the employer options and compare that to what Medicare is having to offer. And if that's a better plan, you may want to go on Medicare while you're still working. Use this special enrollment period. Now remember, you always have to take into account how that decision to go on Medicare will affect others that are covered by your insurance plan. Secondly, we know that there are many people who are still working, but they have set a retirement date sometime in the future. And we really highly suggest that about 90 days prior to your retirement date, when you lose your insurance, you need to start doing all the paperwork that's necessary using the special enrollment period. Again, 90 days in advance is plenty of time. So let's suppose that your insurance is going to stop July the 1st, and you're going to retire the very last day of June, and you need to start Medicare in July. Again, we'd like to talk with you about 90 days prior to that, doing all the special enrollment paperwork that's necessary so you can come into Medicare very smoothly, very seamlessly. You'll stop the group plan and go on to Medicare, and that can be done in about 90 days prior to starting Medicare. Now, this last statement says that you can sign up and start Medicare coverage anytime within 8 months after, now notice this, after your current or your active employment provided coverage ends. Now, this scenario normally works out this way. These are for people that may show up to work one day, and again, they're over 65. They may be 72 or 69, and they find out that their job has been terminated. Maybe their department is closing down or the company is going out of business. And very abruptly, they're going to lose their group plan. There really is no need to panic, because if you're still working and you lose that coverage, you actually have 8 more months to come into Medicare. Now, it will not take 8 months to start your Medicare benefits, but you still have that 8 months of what we call grace period. And so if that's your scenario, what you'll need to do is come into Medicare using your special enrollment period. The main thing we also want to point out here is this extra 8 months of grace belongs to only those people that are coming off current active employment provided coverage, which means someone is still working, right? This doesn't mean that if you're on COBRA right now and turning 65, that you have an extra 8 months. Or if you're on a retiree plan and you're coming into Medicare, that you have an extra 8 months, because you do not. Only those that are coming off active employment will get that extra 8 months. So if you're turning 65 and you are on a COBRA plan or retiree plan, just remember you want to use your initial enrollment period, because the special enrollment period is not something that you are going to be able to utilize. And then we highly, again, recommend that you start this special enrollment period in any of these scenarios 90 days before your desired Medicare start date. All right, so that's those of you that are in scenario number 3. You've worked past 65, ready to retire. And so let's go through just a quick summary here of the details of using an SEP and using that enrollment period. First of all, what we have to do is you're going to need to prove that you have had continuous credible coverage based upon active employment since you turned 65. The way we do that is there's a form called CMS L564, and your employer is going to need to fill that out. If you work with us, we're certainly happy to send that to you in PDF form. Your employer, the HR department, will complete that. It's very simple to do so. Step number 2, then there's another form called CMS Form 40B, and this is your request to enroll into Medicare. That form needs to be filled out by you. We'll show you how to do that as well. And then we highly suggest that you hand deliver both of those documents to Social Security. Typically, an appointment is not necessary. Now, it is true that Social Security would say, oh, you can just mail that in, or you can just drop that off the office. Our experience has been that many times those do not get processed properly. So we like you to take the time to hand deliver to somebody there at the counter at the Social Security office, and those will then typically get processed properly and will get to the right department, so that we don't have to find out 2 or 3 weeks later that they don't have your documents in their system. system. And so that's the safe way to do it. And then step number 4, your card will arrive from Medicare in about 4 weeks of completing this process. So that is using the special enrollment period. Again, we recommend doing this process 90 days before you want your Medicare to start.
Okay, that was great, Dad. Thank you so much. Everyone, take a deep breath. I know that was a lot. I'm going to do a quick review here real quick. So there's 3 types of people. The first type, those who are turning 65 soon and retired already or retiring. What is your responsibility? Well, you are going to enroll into A and B, Original Medicare A and B, using your initial enrollment period. If you're on Social Security, your card should show up about 100 days before your birth month automatically. If you're not receiving a Social Security check, you're going to need to self-enroll. Second group, those who are 65 or maybe 70, but you plan to continue working. You do not have to do anything right now, okay? You can sign up for Part A if you'd like, but you do not need Part B, okay? Now you're welcome, if this is you, to go through and compare the costs and the coverage that you have on your work plan and compare that to Medicare. We find when people do that, about half of them decide to go on Medicare and about half of them decide to stay on their employer plan, but that is up to you to compare. If you decide to stay on your employer provided plan in the future, you will enroll using your special enrollment period, okay? Now, this third group is those who've worked past 65 and now it's time for you to retire. You are going to enroll into A and B using your special enrollment period. Here's what you're going to need. You're going to need proof from your employer that you've had continuous coverage since you turned age 65, okay? If you've had that, then you will not have any Medicare penalties. You'll have no gaps in coverage. Everything will be seamless, okay? You're going to use these 2 forms to go ahead and sign up. Now, if that's basically everyone who's watching this. You should fall into one of those 3 groups. Now, if all this sounds like a ton of confusion and work, that's okay. I'm going to show you, whenever we get to the end of this presentation, how you can get an expert to walk beside you and figure all this out and help you get all this set up in the proper manner. Okay, so let's dive back into the 4-step formula. We just covered step 1, determining the correct enrollment period. Let's go to step number 2. You need to decide between Original Medicare or a Medicare replacement plan.
All right, thank you, Josh. So let's look at these 2 options for your Medicare coverage. Option number 1 is what we call the Original Medicare system. Of course, that began in 1965. And here's what it looks like. This means that you enroll in the Original Medicare A and B. Along with that, you're probably going to get some type of a Medicare supplemental plan to fill in the gaps that the Original Medicare does not cover. And in addition to that, we also have to get a prescription drug plan for your medications that you take. We call those standalone drug plans. So that's what the coverage will look like if you decide that Original Medicare is in your best option. Option number 2 is to do something totally different. This is a system that came into being in 2003. These are called Medicare replacement plans, or we call them Medicare Advantage plans. And those plans, in regards to the drug coverage, will have an embedded prescription drug plan just included within that Advantage plan. So those are 2 options that are before you, and it's the only 2. And you ultimately are going to have to decide which one of these is going to be the very best coverage for you. So what we're going to do first off is focus on option number 1, staying in the Original Medicare system. Original Medicare has 2 main parts. Part A, which is basically everything that's going to be inpatient care. Part B, pretty much everything that's going to be outpatient care. So let's look at Part A and what you need to know about Part A. First of all, it's going to cover everything that relates to inpatient services, which means you've been admitted to a facility. Now, for 99% of all people, there is no cost for you to have Part A. Now, there's cost involved in Part A, but as far as having a premium, there's no monthly premium for Part A for about 99% of all people. If you or a spouse that you're drawing benefits from has paid into the Medicare/Social Security tax system for at least 40 quarters, Part A will be free to you. In addition, Part A has no networks whatsoever. In other words, you can go to any inpatient facility, be that skilled nursing or be that a hospital, and you don't have to worry about whether they're in your network or not, because there's no networks. As long as that hospital or that skilled nursing facility takes Medicare money, you're eligible to go to that facility. And so what will be covered under Part A, first off, you've been admitted to the hospital, so all the inpatient hospital care bills will be paid by Part A. Secondly, skilled nursing facility. This is nothing more than inpatient rehab. Maybe after a stroke or after a joint replacement, the doctor wants to admit you to facility for rehabilitation. That'll be skilled nursing, and Part A will pay the bills. In addition to that, hospice. If someone is on Medicare and they have been diagnosed with a terminal illness, 6 months or less to live, then the hospice bills will be paid by Part A of Medicare. And then lastly, home health care. Again, used very frequently today because it is the lowest cost option for rehabilitation. In this scenario, someone's been in the hospital, and then instead of sending them to a skilled nursing facility, doc sends them home, and then a Medicare-approved home health care agency will come to the home for the rehab, and Part A will pay the bills for that. And so that's the coverage. Now we want to talk about the cost. In other words, your financial responsibilities and your financial liabilities involved in using your Part A of Medicare. First of all, it begins with the deductible of $1,316. Now this is the deductible that's been established for 2017. Now this deductible is not an annual deductible. I know most people are accustomed to annual deductibles. Medicare does this deductible a little bit differently. They call it a benefit period. And a benefit period begins when you're hospitalized, and then eventually you're discharged, and the benefit period continues 60 days after you've been discharged, which means if something happens after you're discharged during that 60-day period where you have to go back to the hospital, it could be the same event that caused you to be rehospitalized or a new event. The event doesn't matter. It just means that during that 60 days of being discharged, you have to be rehospitalized. You're in the same benefit period and you're under the same deductible. But if 60 days has lapsed after you've been discharged and then something would cause you to be rehospitalized, then you will actually start a new benefit period and you're going to have to pay another deductible of $1,316, which conceivably means you could pay this deductible up to 5 times in a year because it's tied to a benefit period and not an annual period of time. And so what will be covered here, of course, will be hospitalization, and up to 60 days in the hospital, that's all you will be billed by the hospital. Folks, it doesn't matter if you're in the hospital 1 day or 2 days or 10 days or 60 days. That deductible is all you'll have to pay. And it doesn't matter if the bill is $50,000 or $1 million. The first 60 days, the only thing out of your pocket is $1,360. That's it. Now, if you happen to be in the hospital longer than 60 days, which is fairly uncommon, but if it happens, here's the way Medicare is going to bill that. After 60 days, the next month, 61 days to up to 90 days, you're going to pay $329 a day copay, which is almost about $10,000 for that month alone. If you're still in the hospital, again, you're very ill at this time, the next 2 months are going to cost you about $20,000 per month. And so this is the way Medicare is going to bill it for extended hospital stays. So that's hospitalization liability. In addition, as we said, Part A also will cover your skilled nursing, inpatient rehab. Your responsibility is this: the first 20 days, no cost to you. Medicare says as long as you have been in the hospital at least 3 days, so 3 days or longer, then they will pay all your expenses for the first 20 days. If you're in less than that, 3 days, Medicare won't actually pay anything. But if you've been in the hospital 3 days or more, there's no cost to you for the first 20 days. After that, Medicare covers you another 80 days at $164.50 per day, which ends up being about $5,000 a month. So that's skilled nursing facility. So that is Part A of Medicare. Now let's talk about Part B and what you need to know. First of all, Part B primarily is going to cover things that are related to outpatient services. Now, Part A was free, but Part B is not. Part B has a monthly premium. The 2017 rate is $134 a month. Now, if you're on Social Security, that $134 is going to come out of your Social Security check. If you're not, they're going to bill you for that on a quarterly basis. And so again, most people pay $134. Now, if you're single and you have a modified adjusted gross income of $85,000 or less, this is what you'll pay for your Medicare Part B if you start in 2017. If you're a married couple and your modified adjusted gross income is $170,000 a year or less, then again, you each will pay $134. The modified adjusted gross income is your adjusted gross income plus tax-free interest income. And so Medicare establishes that threshold. So if you're single below $85,000 or if you are married and below $170,000, you will pay $134. Those of you that will be above that threshold, you will actually pay a surcharge. In other words, you'll pay more money for your Part B premium. And again, that's very important for those of you that are high income, and we can have that private discussion to establish exactly what your Part B will be. But again, most people are going to pay $134 for their Part B premium. Now, with Part B coverage, everything that's related to outpatient services, there are also no networks. You don't have to worry about HMOs and PPOs within the Medicare system. As long as that doctor, that surgeon, that durable medical equipment provider is in Medicare and they take Medicare money, then you will be able to go to that particular provider. So you don't have to worry about networks. Medicare is the network. Next question is, what will Part B cover? Well, it's going to cover everything that's related to outpatient services. So that would include any kind of outpatient surgery, lab work, MRIs, those types of things. It includes also all doctors and specialists that you go to see in their office or they come to see you in the hospital. Remember, Part A pays the hospital. Part B always pays the doctors, whether that's inpatient or outpatient. In addition, Part B will pay for all the preventive services. Many of you ladies probably do your annual wellness exams. That's included in your preventive services, and Part B will pay the bills. Men have services that they're covered as well. And again, Part B will pick up those expenses 100%. And then also durable medical equipment. It could be that someone needs a wheelchair or a walker, or maybe they have a CPAP machine, or maybe they're an insulin-dependent diabetic and they need test strips or lancets, or maybe an insulin pump. All those things, walkers and beds in the home and those types of things are called durable medical equipment. And Part B will pay the bills for those types of things. And then lastly, home health care. And you'll recall that we saw home health care coverage on the A side. So it's also on the B side, because this would be home health care that's necessary after an outpatient surgery. A doc sends you home and the home health care agency will come, and because it started in the outpatient side of Medicare, these home health care bills will be also paid through the Part B. And so that's what's covered. Let's look next at your financial responsibilities, your financial liabilities. Well, Part B begins with a deductible of $183. It is not like the Part A deductible. Remember, that was tied to a benefit period. This is just simply an annual deductible. More accurately, it really is a calendar year deductible. You pay the full deductible that year, regardless of when you start your Medicare benefits. So if you start in July, you'll still have a full deductible of $183, and it's not prorated, and that deductible must be paid by December 31st, and then this will reset again in January 1, and then you'll have a full 12 months. But again, it's not prorated. It's a full $183 for 2017. Now, after that deductible is met, Medicare is going to pay 80% of the bills. You're going to be responsible for 20%. Now, I want you to know that the 80% that Medicare covers is based upon those things that Medicare says are medically necessary. All right, just because you feel like you need to have something done, a procedure, doesn't mean Medicare is going to cover it. So you always have to ask, is this Medicare approved? Is this something that is medically necessary? And if it is, Medicare pays 80% of the bills. Your responsibility is 20%. Now, the problem with your 20%, which is called co-insurance, is that there is no limit. Your 20% is unlimited. Now, all of you who are not on Medicare, your plan stops somewhere. We call it a maximum out-of-pocket. And most plans set an annual max out of pocket. Medicare does not do that. Both A and B of Medicare has no stop loss whatsoever. They're both unlimited. So sky's the limit on your financial responsibility. And then lastly, something else that's unique to Medicare is there are some physicians that do not agree under contract to accept Medicare approved amounts. Now, a doctor that does not accept Medicare-approved amounts can legally still see you on Medicare, can still file claims with Medicare and still get Medicare reimbursements. But that doctor is going to add up to an additional 15% to the Medicare-approved amount. That is called an excess charge. Medicare allows doctors to do that. Okay, now, doctors that don't charge the extra 15% are called doctors under an assignment contract. And that assignment contract doctor cannot bill you beyond the Medicare-approved amount. But a doctor not under that contract will add 15%. That's called an excess charge, and you are responsible for it.
So let's review these financial liabilities very quickly. Part A, you've got a $1,316 deductible, which you could pay multiple times a year. There's also some daily hospital copays and skilled nursing facility copays. B, which is outpatient side, you've got a $183 deductible once every calendar year. Then you're going to pay 20% of all the bills, no max. The sky is the limit. So if you had $1 million worth of bills, you'd be on the hook for $200,000. Okay, and then on top of that, you can be charged a 15% excess charge. Okay, so you could pay up to 35% of all your bills with no max on that.
Now, folks, Josh just reviewed with you the gaps that are involved in the Medicare system. In other words, the financial responsibilities that Medicare expects you to pay. Those are yours. Now, again, Medicare pays very well, but it is not 100% coverage. And so you have to share in the cost of some of your health care needs. We call that cost sharing or cost shifting. Okay, that's just simply means there's a gap in your coverage. Okay, these are expenses you're responsible for. So either you pay for those expenses out of your own pocket or you purchase what is called a Medicare supplemental plan. Some people call these Medigap policies. They are the same. And so you purchase an insurance policy so that those policies then can cover those expenses for you. All right, so there's 10 supplemental plans that are on the market today: A, B, C, D, F, and G, K, L, M, and N. Okay, now these plans are all standardized by Medicare. And what we mean by that is that Medicare, not the insurance company, will determine each of these plans' benefits. Okay, so the insurance company is not picking and choosing what they're going to pay and not pay. Medicare has already determined that. And then the plan that you purchase then is going to follow those items that Medicare says now you will be responsible for. All right, and so again, those plans, 10 available. And in most markets throughout the country today, about 95 to probably 97% of all people are purchasing Medicare supplemental plans F and G. And so we're going to focus on that today. Doesn't mean the other plans are not good. It's just the majority of people find that they're more comfortable with eliminating most of the risk involved in these gaps, and F and G is going to do that primarily the best. And so the plan F is the one that covers all the A and B gaps that we just taught you. Okay, the deductible on the A side, remember the $1,316, the deductible on the B side, the $183. The co-pays you're responsible for if you have extended hospital or skilled nursing stays. The 20% co-insurance. Part F will pay that 100%. And then if you happen to go to a doctor, that adds that extra 15%. Your Plan F will also pay that. So the point is, if someone has a Plan F, and as long as Medicare paid first, then that F plan will pick up all the balance, 100% of the remaining expenses, 100% of the time. You should really never get a bill. We tell the folks who take Plan Fs that if they do get a bill, don't pay it quickly. Let's find out what happened. Normally, it's a coding issue. It wasn't coded correctly. Medicare didn't pay, and therefore the F didn't pay. Remember, F's going to follow as long as Medicare paid first. Or it could be that you did something that Medicare says, we're just simply not going to cover that. All right, and so if they're not going to cover it, the F plan's not going to either. And so as long as Medicare pays, then F will follow 100%. Now the Plan G is very close. Again, it's going to cover all the A and B gaps that we just discussed, except the Part B deductible. This year, that's $183. So that would be your responsibility. All right, so that's the difference between F and G. F pays everything, G pays everything except for the $183. And so if you have a Plan F, you will not pay any bills. It's 100% coverage from day one as long as Medicare paid first. If you have a Plan G, you will only pay your Part B deductible. Again, this year that's $183, and then nothing more after that deductible has been met.
Okay, Dad, let me just review this. So we have all these financial liabilities. If you buy a Plan F, everything is covered. Ladies and gentlemen, if you purchase this, it's 100% coverage right out of the gate. Okay, the Plan G, almost everything is covered. Everything will be covered except for this $183 deductible that's circled. That is the only difference between a Plan F and a Plan G. So in summary, I need you to realize this. All F plans, no matter what insurance company you purchase it from, will offer identical benefits. A Plan F is a Plan F is a Plan F is a Plan F. One company is not going to cover something that another company would cover. They're all going to cover identical benefits, okay? Just the same, all G plans, no matter what insurance company you purchase it from, offer identical benefits. What's going to be the difference then? Well, the name of the company and the premium you're paying for that plan, Now, original Medicare will not cover a few things.
And that is this. Let me go through that list real quickly, Josh. Original Medicare is not going to cover, first off, long-term custodial care. Folks, as a reminder, Medicare exists for the purpose of covering diseases and illnesses and accidents and injuries, those kinds of things that they determine to be medically necessary. Long-term custodial care is important, but Medicare doesn't cover it. This is for people that are in a situation, maybe because of age or some type of an illness, where they need assistance on a daily basis with bathing, or maybe dressing, or eating, or getting in a wheelchair, or from the bed to the wheelchair, or maybe they can't take the right medications because of dementia or Alzheimer's. Those are custodial needs. Medicare is not going to cover those type of things. Also, Medicare will not cover routine eye or dental care or dentures. Now, let's suppose that you're a diabetic. It is necessary medically for you to have two eye exams every year because of the complications that diabetes can have upon your eyes. Well, those are medically necessary, and that would be covered by Medicare. But if you don't have diabetes and you're just kind of curious if you need a new prescription and you're having really no vision problems, then that routine eye care will not be covered by Medicare. Again, dental care. Let's say you need a root canal, or you need a crown, or an extraction, or a filling, or something. That's not going to be covered by Medicare. They determine that to be not medically necessary, certainly not dentures either. Now, in addition to that, if you decide you need some kind of cosmetic surgery or elective surgery that Medicare says is not medically necessary, Medicare will not cover it, nor will your supplemental plan. Remember, Medicare has to pay first, and then the Medicare supplemental plan is going to follow. Now, Medicare will cover chiropractic adjustments, but if you go to a chiropractor and the chiropractor suggests acupuncture or maybe wants to do x-rays or something at the office, Medicare will not cover those expenses. Just the adjustment of the spine will be covered by Medicare. And then lastly, hearing aids or any hearing exams for fitting those hearing aids will not be covered by Medicare. And our point is this: if Medicare is not going to cover it, then your Plan F is not going to either. And your Plan G is not going to either. Medicare must pay first, and then those other plans are going to follow what Medicare did not pay according to the rules of that particular plan. Now, let me just mention there is one exception to this. Remember, Medicare must pay first. The exception is what we call foreign travel emergency benefits. If you happen to be out of the country, Medicare is not going to pay any expenses, but several of these plans will actually give you $50,000 worth of foreign travel emergency benefits. So if something happens outside the country, the plan will actually help you with some of those expenses. There is a limit to that, and there's some rules to that. Number one, it'll only pay up to $50,000 over your lifetime while you have the plan, and after a small deductible, then the company will pay 80%, and then you pay 20%. And so we just want to remind you that Medicare only covers you while you're in America and then in the U.S. states or in the U.S. territories. And then these plans will pick up an additional $50,000 for you since Medicare will not cover anything. Okay? Now, option number one, what you need to know is this: starting on your Part B effective date, meaning you're off a group plan, you're off an individual plan, and you're going on Medicare. When that Part B effective date begins, you're going to be given a 6-month window. And during this 6-month window, you're going to be given a once-in-a-lifetime right to buy any Medicare supplemental plan. All those 10 are available to you, and there's absolutely no medical underwriting whatsoever, which means even if you have pre-existing conditions, the insurance company is going to give you that policy. Because frankly, we do not have to ask you any health questions during the 6-month period of time. All right, so 6 months to buy anything that you want, regardless of your health status. Now, here's the way it works. That 6-month period of time begins on your Part B effective date. So you can take a plan any time during that 6-month window of the effective date with no underwriting. But you don't have to wait until that period of time, because insurance companies can actually legally take your Medicare supplemental application 3 months prior to your Part B effective date. Now, it's not going to start until the Part B starts, but they'll take it 3 months in advance so you don't have to wait until your Part B starts to make a decision about what supplemental plan is best for you. This can be done 3 months in advance, and you can shop and compare and get everything set up so that when your Part B begins, your supplemental plan will begin on that very same day as well. Now, Medicare supplemental plans are issued as guaranteed renewable for life. There are several plans within the Medicare system that are only good for a year at a time. That's the Advantage plans and the drug plans, which we'll talk about. But the difference is supplemental plans are for the rest of your life. In other words, the insurance companies can never cancel a supplemental plan unless you miss a premium. So if a person misses a premium, the insurance company is required to give you 30 days of grace to pay the premium in order to bring the policy current, and that policy will keep going on for the rest of your life if you want to keep it. But if you miss a premium and you do not bring the policy current within that 30 days, they then have the right to cancel that policy. But as long as you pay the premium, it will be for life. Now, I've covered option number 1 in great detail. Hopefully that makes sense to you. So if you stay in option number 1, that means you're using original Medicare. Medicare is going to process the bills and they're going to pay claims for you. A is going to pay inpatient, B is going to pay outpatient. But because of the gaps, we have added a supplemental plan to that, one of the 10 that we just discussed. Most people, again, go with F or G. And then in addition to that, of course, you're going to have a drug plan that will be included. So those are the details of option 1. Now let's look at option number 2. These are called Medicare Advantage plans or Medicare replacement plans. And again, the drug coverage will be included within the Medicare Advantage plan. So what you need to know. Number 1, Medicare replacement plans are usually called Medicare Advantage plans or Part C of Medicare. And again, to be able to have a Medicare Replacement Advantage plan, you have to be enrolled in Parts A and B of Medicare, which means the A, which is typically free, will continue to be free, but the B, you're going to have to pay that premium. Again, this year, $134 for your Part B. Also, these Medicare replacement plans are offered by private health insurance companies. In other words, the government does not make these available to you. They just simply approve the companies and the coverage that they're going to be offering to Medicare recipients. So that's the difference. Original Medicare A and B is that government system. This is a private health insurance company that's replacing A and B. These plans do have networks. That's one of the biggest differences. Original Medicare had no network. You'll always have a network. In the Advantage plans, it'll be either the HMO plans or the PPO networks. In addition to that, another difference is you will pay a copay for all your services. In the original Medicare A and B, we had very few copays. Remember, only for extended hospital and skilled nursing stays. But when you go on an Advantage plan, you will have a copay for everything that you do until you hit a certain maximum out of your pocket. So it's a copay-based plan. And so here's a sample of those copays. You can see if you go to your primary care doc, somewhere between $5 to $25. You see a specialist, $40 to $50. If you go to urgent care, you'll see it's $30 to $50. The emergency room, again, here's the range for that. If you have an outpatient surgery, let's say cataract surgery or maybe your gallbladder removed or something, you'll pay a copay for that. Your MRIs, your CAT scans, PET scans, each of those tests are going to range somewhere between $250 to $400. Every time you go to outpatient rehab, usually it's about 3 days a week. Each time you did that, you would pay a copay for those services. Your labs and x-rays, again, will be $0 if it's preventive. The Advantage company will cover those costs for you, but if it's something that's diagnostic and non-preventive, then you will pay up to a $50 copay for labs and x-rays. And then the hospital daily copays right now are in the range of $275 to $335. Now you recall that the Advantage plans usually do not have a deductible for medical expenses like we did have on the Part A. So the way they bill you is every day you're in the hospital, you're going to pay a daily copay. Most plans will cover you for about a year's worth of coverage, and you only have to pay the daily copay for up to 5 days and sometimes 6 days. And this daily copay covers every service that you receive while in the hospital that day, whether that's minimal service or major service. That daily copay will always be the same up to a certain limit, again, 5 or 6 days, and then they'll cover you beyond that at no cost to you. And then these copays, of course, will be recorded, and they're going to keep a total throughout the year, and then the plans then set a maximum out-of-pocket. So it doesn't matter if the bill's $100,000 or $1 million, you're going to pay in this range between $3,500 to $6,700, depending upon the plan, whether it's an HMO or a PPO plan. All right, so that's option 2 of the Medicare replacement plan. So we see what we need to know. First of all, I want you also to know that the Medicare replacement Advantage plans almost always will have a prescription drug plan included within that plan. It's just simply embedded. Also, what you need to know is that in order to get a Medicare replacement plan, we're going to have to ask you one medical question, and that is, do you have end-stage renal disease? End-stage renal disease is someone that is probably on dialysis, or maybe they're waiting for a kidney transplant. And if that's your medical condition, end-stage renal disease, then you will not qualify to have a Medicare Advantage plan. You'll need to stay in the original Medicare system. Now, let's suppose that you take an Advantage plan and you get end-stage renal disease. The plan will not kick you off. They will continue to cover you and actually cover you well. But you can't change plans and get with the new company if you have end-stage renal disease that you get after starting your Advantage plan. In addition to that, all the plans in the Advantage system will change annually. In other words, it's an annual agreement between Medicare, the insurance company, and you. Right? And there are times when the Advantage plans actually will make major changes. Some of them can even discontinue the coverage, and they can actually pull out of the market. So they will change annually, which gives you the opportunity to also change annually. Remember, we also said that there are networks, that's HMO and PPO networks, and there are specialists and doctors and hospitals within those networks. And those networks also can be changed on an annual basis. Sometimes doctors or specialists or hospitals can even choose to leave that particular plan if they're not happy with the reimbursement rates. Now, these plans can be switched every year. Medicare has an open enrollment period. That's 7 weeks during October 15th through December 7th. So if you ever need to change a plan, this is the time that we do that. And then your new coverage would begin January the 1st of that following year. So those are some things you need to know about Medicare replacement plans.
Okay, hey guys, I really want you to get the differences between option number 1 and option number 2. So here's the 3 most important differences compared to option number 1. Number 1, Medicare Advantage plans or Medicare replacement plans are copay based plans. You're going to pay as you go. There is a copay for every service you receive. Because of this, the premiums are cheaper. You're going to pay somewhere between $0 to $50 a month, so not very much for this coverage. However, if you want to switch back to option number 1 after using an Advantage plan, you must medically qualify in order to switch. Okay?
You know, Josh, let me just add this too, because this is some real confusion. A lot of people think that once they go into Medicare that they can just switch anytime they want, and folks, that's just not true. It is true that you can switch, but there are usually rules that are applied to this switching. And so if someone says, oh, you can just switch, that is not the truth. You've got to know the rules for switching the plan. Go ahead, son.
Right, so now, there is one little tiny exception to this third point, okay, where it says you must medically qualify to switch. For some of you, in specific circumstances, you're going to have a 12-month trial period to try a Medicare replacement plan or an Advantage plan, right? So you're going to be able to try that and then be able to switch back to the better coverage, which would be option number 1, anytime within that 12 months. But beyond that and beyond those people that have that, you're going to need to medically qualify in order to get back to option number 1, which is a supplemental plan. Okay, I've prepared one other slide so you can really get the differences. Option number 1, you're going to have higher monthly premiums. Option number 2, you're going to have lower monthly premiums. Okay, number 1, premium-based coverage. You're going to pay a monthly premium. Option number 2, this is more pay-as-you-go. Okay. Option number 1, little to no out-of-pocket expense beyond the premiums. Okay, you get a Plan F, it's 100% coverage. You get a Plan G, you have a $183 deductible, and then everything is paid for after that. Option number 2, you're going to pay a copay for every single service you receive, up to the annual max, which will reset every January 1st. Option number 1, you have to purchase a standalone Part D prescription drug plan. We're going to talk about that here next. If you go with option number 2, usually a prescription drug plan is included in the plan, okay? If you go with option number 1, that's your plan for life. They can't cancel it on you, okay? Option number 2, the plans can change yearly. Hey, plans can pull in and out of markets, okay? They'll change the plan every year, guaranteed, okay? Option number 1, medical underwriting is required to get these plans. You get a supplemental plan, you're gonna have to be medically underwritten, except whenever you first go on Medicare during those first 6 months, right? That's your open enrollment. You're guaranteed issued to be able to get whatever plan you want with no medical underwriting. If you go with option number 2, there's pretty much no medical underwriting except you can't have end-stage renal disease. So you can almost always get a Medicare Advantage plan, but you can't always go back to option number 1. So here's the big picture. Option number 1, you have original Medicare plus a supplemental plan. Option number 2, you just have a Medicare Advantage plan. Now, if you go with option 1, you've got to get a standalone prescription drug plan. Option number 2 has a drug plan included. So that brings us back to our 4-step formula. Step number 1, determine your correct enrollment period. We did that. Step number 2, we're going to decide between original Medicare or Medicare replacement. We just went over that. Now, guys, if that was a lot to get, a lot to understand, I want you to know at the end of this presentation, we've worked out a really special deal that I think almost all of you will take advantage of in order to learn how to work with an expert so that we can help you say, hey, which of these options actually is better for your specific situation? So we're going to go into that here in just a few minutes. But before we do that, let's go to step 3. Compare drug plans using a simple process.
All right, Josh, thank you very much. So first of all, folks, in dealing with the drug plan, what you need to know about drug plans. Now, all drug plans, first of all, are going to have a network of pharmacies. Within the network of pharmacies, we have preferred pharmacies and standard pharmacies. Preferred pharmacies are going to give you a better price. So you always have to find out, is the pharmacy that you would like to go to, is it considered preferred or standard? If it's preferred, again, the pricing will be better. Your copays will be cheaper. If you have standard, again, you're going to pay a little bit more for that. Also, all the drug plans are going to have a unique drug formulary. And folks, this is the most important part of deciding upon a drug plan. You want to be sure that you can get all your medications covered by the formulary. And then, frankly, there are some meds that will never be covered by Medicare. But if we know Medicare says it's medically necessary, then we want to find a formulary that is best for you. Every prescription that's covered in that formulary will also have a number beside it called a tier number. And all that tier number does is establishes what your copay price will be. Also, all the drug plans are annual contracts. Okay, in other words, you can change them on an annual basis because through your life you may add medications or you may drop medications. Sometimes medications are very inexpensive, other times they're very expensive. And so Medicare makes an allowance for you to be able to change drug plans if your situation changes with your medications. Again, the open enrollment period, as it was on the Advantage plan, the same time for drug plans, October 15th through December 7th. So they give us a 7-week period every year to make sure that we have the right drug plan, and so you can change plans, and the new coverage would start January 1st of the following year. In addition to that, all drug plans will utilize 4 stages that reset every January 1st. So they reset every single year. Now, let me tell you what we mean by this. Let's compare your present plan, meaning your group plan or your individual plan. You almost always only have 1 stage on non-Medicare plans. That stage is you pay a copay. And that copay is what you pay when you get the prescription filled. Whether you get it filled in January or July or December, you just simply pay a copay. So that's a 1-stage plan, copays only. It's not that easy in Medicare. Medicare has a 4-stage process. So there's 4 stages you have to be aware of, and I want to make sure you understand these very clearly. Stage number 1 is what we call the deductible stage. Medicare establishes the deductible for Part D plans. The insurance companies do not determine this. Medicare says what the deductible is, and that is $400 this year, 2017. Now, one nice feature about it is that deductible is usually not applied if you're just taking generic medications. But it does apply on almost all plans if you're taking brand medications. So the $400 deductible can be waived for generics, but you'll pay it on the brand names. So again, the deductible is generally waived on generics, and then after you've met this deductible or you're on a plan that waives the deductible, then you move to stage 2. And we call stage 2 the copay stage. All right, so I'm going to give you a quick sample of what some of the copays will be depending upon the tier. And you can see tier 1, very low cost, tier 2, again, very low cost. And then we start paying a little bit higher premium for tier 3s, preferred brands, and non-preferreds a little higher for that. And then specialty drugs, which very few people are on, but whenever you are, that's a co-insurance, a percentage of the cost of medication. And again, this is our copay stage. And folks, what happens is this is all you will pay until you reach a total retail cost of $3,700. And again, this is something unique to Medicare because every time you get a prescription filled, Medicare is actually tracking the retail cost of that medication. Now, you don't pay the retail cost, but Medicare tracks it. And The reason they're tracking it is because once you reach this $3,700 of stage 2, then you've reached the maximum on this stage, and then Medicare is going to move you to stage 3. But I want to emphasize this is total retail cost. So they're tracking the retail cost of the medications, and once it reaches $3,700, whenever that is, that could be in September, it could be in July. I've seen people meet this in 1 month, but whenever that is, then you're going to move to stage number 3. Okay, and that stage number 3 is called the coverage gap. We call it the donut hole. And so the only reason people ever go to the donut hole is because they have reached that threshold on the retail amount of $3,700. Okay, and so once they reach that threshold, they go to the donut hole, and now medications typically get more expensive. If you're on a generic medication, no longer are you going to pay a flat copay, you're actually going to pay 51% of the retail cost of that medication. If you're on a brand name medication, you'll pay 40% of the retail cost of that medication. Okay, so again, your out-of-pocket expense is going to change here in stage 3. Oftentimes, we'll see your out-of-pocket expense in stage 3 double or even quadruple. You're taking on a greater financial responsibility. That's why most people hate the donut hole, right? And so you're going to remain now in this stage until total out-of-pocket cost reaches $4,950. That's your out-of-pocket cost, which includes the deductible that you had to pay. It includes all the co-pays that you've had to pay. It includes everything you spend in this stage as well. The 51% of the generics, 40% of the brands. All that's going in your total out-of-pocket cost. So they're totaling that cost, and once it reaches $4,950, then you move to stage 4. Now here's the good news. That total is not all out of your pocket because Medicare makes the brand name manufacturers discount your medication 50%. And that 50% discount is included in that $4,950 number. So in there was your deductible, your co-pays, your co-insurance, and the 50% that you didn't pay that the manufacturer had to discount. So again, that's not out of your pocket, fortunately. Okay, then if we meet that number, $4,950, then we go to what's called a catastrophic coverage. Now, this is a place where no one's upset like they were in the donut hole because medications are very inexpensive. You'll pay the greater of 5% of the retail cost or a flat copay for generics and a flat copay for brand name medications. Okay, so again, these are the 4 stages. When you start your Medicare, you start working through these 4 stages based upon those financial numbers. And then again, these are going to reset every January 1st. And we start with stage 1, we just go all the way through stage 4 again. So stage 1, again, is a reminder, the deductible stage. Either you pay it out of your pocket, $400, or it will be waived by the plan. Stage number 2 will be copays. Again, everyone's happy here. We're just simply paying small copays depending upon the prescription that you're on and depending upon the tier that has been established for that particular medication. And we stay here until the total retail cost reaches, in 2017, that number is $3,700. Again, that's not your cost, that's the retail cost. And once we reach that amount, then we go to stage 3. And here we're in the donut hole. Again, paying 51% of the cost for generics and 40% of the brands. And we stay here until total out-of-pocket costs reach that $4,950 number, which was everything you paid in stage 1, stage 2, stage 3, and the manufacturer discount of 50% on the brand name medications. And then we go to stage 4. Again, everyone's happy here. Medications are very reasonable. You pay 5% of the actual cost of those medications. So this is step 3. In other words, we've shown you what is going to be covered and what your financial responsibilities are, but let me show you how to compare drug plans using a very simple process at Medicare.gov. So first of all, we want you to make a list of your medications in the following format. We want to know what the actual medication name is. Whether it's a brand name or a generic, whatever you're taking is the name you're going to use. Then what's the dosage? Are you taking 10 milligrams or 20 milligrams? You want to make sure you record that. And then how often? Is it 1 a day or 2 a day? So we want to know the frequency. So this is your list of medications. Then secondly, what we're going to do is we need to know what is your preferred pharmacy. What's your pharmacy of choice? And we also recommend recommend that you select a second pharmacy that you would be open to going, because sometimes the prices of your medications can vary, so it's best to use two. And the Medicare.gov system will actually shop two of those pharmacies for you, so take advantage of that. And then number three, you're going to go to Medicare.gov and you're going to input all the information that we just talked about, the medication, the dosage, the frequency, and the two pharmacies that you're open to going to. And Medicare.gov, and within truly seconds of you giving them this information, they're going to tell you what all the drug plans that are available for you in your zip code. Most of them have somewhere between 20 to 25 plans, and it's going to rate those in order of the plan that will give you the best coverage of the meds you're on, and then secondly, at the very best price. And we'll rate those 1 through up to 25. And then number 5 here, Medicare.gov will then automatically give you an ID number. That ID number is very important, and along with that will be a password. And that password is going to be the date that all this information then was saved in the Medicare system. And then each year you can go back through and you can check without having to put all that information back in the system. It will be saved for you. It will be recorded for you under this ID and password. So on an annual basis, you can go back in and amend the information if you need to. You've changed medications, add them, remove them, change dosage and frequency so that your records are up to date, and you can always select the right drug plan for you on that annual enrollment period.
Okay, so hey, we are almost done with the 4-step formula. Again, if this sounds like a lot of work, stay with me for just a few more minutes. I'm going to show you how you can get access to a team of experts who can help you. Step number 1, determine the correct enrollment period. Step number 2, decide between original Medicare or a Medicare replacement plan. Step number 3, you need to compare drug plans using a simple process in Medicare.gov. And step 4, choose someone to process all the enrollment paperwork.
Okay, Josh, as people decide how it is they want to do the paperwork, they basically have 3 options. Number 1, we call it the do-it-yourself method. Now, folks, we all know what do-it-yourself means. There are many things in our life that we can successfully do on ourselves, and many times we do things ourselves to save money. We may do home repairs or appliance repairs or car repairs or such. But this is one of those situations where the do-it-yourself method is certainly available, but you're not going to save any money whatsoever. So let me show you what happens on the do-it-yourself method. First of all, this is for someone who tries to do all the Medicare research alone. And folks, I'm talking about hours and hours of research. Scanning websites and looking through printed information, asking lots of questions, making phone calls. And usually what happens when people follow this method, they typically get very confused. Because what happens, it's very difficult to connect all the dots. And before long, they get frustrated. But usually what happens is people get to a time crunch, and now they're going to be forced to make a decision, and they enroll in coverage, and they're not sure if it's even the best. And normally what has to happen is they're going to have to use a call center to do this. And they're going to have to call 1-800-DIAL-AN-AGENT. There will be somebody there who will take your enrollment, but many times those people are not going to really assist you through all the details of making sure that you've made the right decision. So the do-it-yourself person is bound to do business with the call center. Okay? And then what happens is later, many of them find out that they made a mistake. And so what do they have to do? Next year, the open enrollment period begins, and now they want to make another decision and change and switch plans. And so they start this process over again. This do-it-yourself method does not save any money whatsoever, but it is one option. The second option is to use what we call a captive agent. And this is when you decide to work with a company agent. In other words, this is an agent who works only for one company. And every insurance company has captive agents. These are basically employees of the company. And captive agents are going to represent that company and all the products that that company makes available in a given market. Now, the problem is they have a limited portfolio. In other words, they're not going to show you what the competition is offering, because if they do, they're not going to make any money. And so all the plans that really are available to you in your market are not going to be made known to you through the company captive agents. They're going to offer only those things that are in their best interest. You see, their loyalty and their concern is to their company and not to you. And so the company captive agents are certainly available, but again, you're going to limit yourself as to what options are available in your market. And then the last option is to use an independent broker. And an independent broker like us and others, our loyalty and concern is certainly not to any specific insurance company. Our loyalty and concern is for the client's specific needs. And so what we're going to do when you work with us as an independent broker, there's lots of options. In fact, in Kansas City, there are 30 different supplemental companies to choose from. And when you work with an independent broker, they're going to discuss those companies, all of them. There will be 10 different supplemental plans available to you. We'll look at all of those. You're going to have 12 different Medicare Advantage plans in the Kansas City area and 25 different prescription drug plans. So as you can see, there's lots of options. And when you go with a company captive agent, you're going to be limited to just what that company has to offer, basically one company's portfolio. When you go with an independent broker, you're going to be able to look at all the options available in any given market. Okay, and so you have limited options with captive agents and unlimited options with independent brokers. All right, now, what does it cost to use a call center? Well, the cost is zero. So if you're the do-it-yourselfer and you decide that you're going to do that method of doing all your research and deciding upon your own what is going to be best for you, then you'll call the call center, and certainly they're not going to charge you anything for their services. And then the cost to use a captive agent is the same. Again, it will be zero. That captive agent will not charge you anything for their services. And the same thing is true if you use an independent broker like our company. The cost to us is totally zero. So the price is the same. And so you don't pay a consultation fee, you don't pay a commission, and there's no upcharge for your insurance. So whether you use a call center, a captive agent, or the independent broker, the price to you will be the same. Now, before we recommend any options, in other words, if you decide to work with us, what's going to happen is we want to gather a lot of information about you so that we can do all of our homework prior to meeting with you. Number one, we're going to need your contact information. Secondly, we're going to have to know what county you live in, of course, the zip code, your home address. We also want to know about your doctors. First off, your primary care doctor, and then any specialists that you see on a regular basis. We'd like to know hospital preferences, at least two. In other words, if you're going to be hospitalized, where would you like to go? And we also want to know about your pharmacies. What pharmacy would you like to get your prescriptions filled? And we do like to have two because some plans are kind of more exclusive to certain pharmacies versus another. So we would like to have two of those. And then also all the medications that you take. And we want to know the exact name. If you take a brand name, we want to know that. If you're taking a generic, we want to know that. Plus the dosage. Are you taking 10 milligrams, 20 milligrams, and how many times a day are you taking that medication? So we gather that information. In addition to that, we want to know your exact work situation. When are you planning to retire? Is your spouse still working? And what are some of the employment details and insurance information that you have available to you? So we want to gather all the information. And then lastly, we want to talk about your Medicare eligibility dates. And what is your status? Is it time now to go on Medicare or not? And so all these things are going to be evaluated. So we gather this information so that our team of researchers can go through and look at all that information and then decide exactly what all your options will be. Okay, so the Enlighten Your Research Department will compare all the plans in the Kansas City metro area and find the very best plan for your specific situation.
Yeah, hey, we got this testimonial in recently from a gentleman we helped. He said, I'm pretty good at researching things. It took me a long time, but I feel like I finally felt like I knew what I should do about Medicare. After I watched your first webinar, I hesitantly signed up to work personally with Enlighten You. On the day of my consultation, I almost didn't go. I'm so glad I did. The gentleman who helped me brought up 3 or 4 points I had never considered and frankly knew nothing about. In the end, I have even better coverage than I originally was going to get on my own, and the process was so incredibly easy and hassle-free. Plus, I saved about $1,600 a year. And we have story after story after story after story of people just like this gentleman who really, I don't know what I'm going to say. And we have story after story after story of people just like this gentleman who really were greatly helped by not doing it by themselves, but by working with somebody who could really hold their hand through this whole process.
Now, folks, if you decide that you want to work with us, we follow a very organized and very systematic 5-step process. Let me explain how it's going to work. Number one, we ask that you reach out to us. You know, I know that most of you are getting phone calls and lots of mail and really a lot of people that pester you. And that's really not what we're going to do. if you want to do business with us, we would be privileged to help you, but you're going to have to reach out to us. And the way to do that is to click on the Get Started button right here on this page. And if you'll do so, here's what's going to happen. Number 2, we're going to do all the research for you. And literally an hour to 2 hours will be spent on every person's case. And we're going to do all the work for you to make sure that we know every plan option that's available to you in the Kansas City market. Number 3, we're going to sit down with you or do this by phone, and we'll do what we call a review period. It's actually a free consultation. It doesn't cost you any money whatsoever, and we'll take the necessary time to make sure that you know every option that you have available for you as you go on Medicare. Now, this is where our main office is. We're located in the Lighton Tower, Lighton Plaza at College of Metcalf Boulevard. We're on the 5th floor. And this is where our office is, a picture of our office building here. And we'd be delighted to meet with you here. Now, we have a lot of people that we work in the Northland. We also have a satellite office in the Briarcliff area. And so whichever location is most convenient for you, we'd certainly be happy to meet with you at either one of these places. And of course, we can do it by phone if you would prefer. Now, let me just say this about meeting by phone. We're happy to do that. But, you know, folks, this is a very large decision, an important decision you're going to make. For some of you, it'll be the last decision you'll make as far as insurance goes. And so we still prefer kind of the old-fashioned face-to-face meeting. And if that will work for you to come to our office, we certainly prefer that, but we'll do it by phone if we need to. But either way, it's going to be free to you. And then number 4, we're going to do all the red tape. In other words, we'll make sure that you're enrolled in Medicare properly. We're going to make sure that also whatever insurance plans you're going to need, whether that be a supplemental plan, a drug plan, an advantage plan, that all the paperwork that's necessary to get you enrolled on time and properly will be taken care of. And so we'll do all the red tape, nothing that you really have to do, including get enrolled into Medicare A and B. And then fifthly, we're going to assign to you a relationship manager for life. Now, folks, this is really something that makes us different. You see, company captive agents come and go. Call center agents truly come and go. But when you work with Enlighten You, we're going to actually assign to you a relationship manager that will be yours for life. This is someone that you can pick up the phone and you can make a call. You can stop by the office if you want to as well. But this is someone that really is going to have your back, meaning we're your advocate. And I tell people all the time, when we do business, we don't just enroll you. We know that you're going to have situations where you may have problems with claims or things are going to come up and you're going to need to switch plans. And that's what the relationship manager does. We're going to make sure that every year you know exactly what to do as you have to make choices as far as your Medicare coverage goes. And so our relationship manager will assist in that process. Okay, so you really do have an advocate when you work with our company. And so this is our 5-step process. So when working with Enlighten You, here's why people work with us, and we get these kind of comments and testimonials all the time. Number 1, working with us eliminates Medicare stress. I know this is a stressful time. You've got to make some decisions, and you know they're important. You want to avoid the penalties and the problems and all the hassles. And so when you work with us, it will be stress-free. Number 2, working with Enlighten You keeps you from making a lifelong mistake. Sad to say, many people guess at this. They don't give it the proper attention and really pay attention to what's going on, and so they do make mistakes. And when you work with us, that's not going to happen. We're not going to let that happen. Thirdly, you get access to the best health care available. Again, we're brokers, and so every plan available in Kansas City will be an option for you, and we'll explain the differences. Number 4, working with us keeps you from paying lifetime Medicare penalties. Sad to say, many people pay penalties. They've done their enrollment incorrectly, and so those Medicare penalties last for the rest of their life. And so we're going to avoid all that. Working with us also keeps you from enrolling in a terrible plan that you get stuck in forever. There are some plans that if you get on and you don't change them at the right time, it will be yours for the rest of your life. And number 5, it will save you hundreds, if not thousands of dollars every year on your medical bills and your prescription drug costs. So working with Enlighten You has great benefits. Also, you will have a relationship with a local company. The call centers, none of them are in Kansas City. They're all out of the area. And so with a local company, you have someone that you can talk to. You can stop by our office. We're here every day and happy to assist you. And so those are the benefits of working with us.
So if you click Get Started, here's what's going to happen next. Number 1, you're going to be taken to a simple sign-up page where you can enter your contact information. After that, an Enlighten You representative will reach out to you and get the following information. We're going to get your prescription medications, the name, the dosage, the frequency, primary care doctor and specialists. We're going to get your hospital preference and your pharmacy preferences, any other pertinent health and insurance and retirement information. Once we do that, Our research team will then research all of your Medicare options. They're going to go through every plan in Kansas City and determine, hey, do their doctors take this? Hey, are their medications covered by that formulary? Hey, is their hospital part of that network? And they're going to go through and determine all that. And then you and a Enlighten You Medicare broker will meet in person or over the phone and review all of those options. And then if it's necessary, if you see something that you like, if it makes sense, if it's a good plan for you, we can help you take care of all the enrollment forms for the insurance companies, all the government forms for enrolling into Medicare, and get all that done in a timely manner so that your coverage starts at the right time. Get that all completed in a timely manner so that you have the right coverage starting at the right time. Now, if you're not sure you need Medicare yet, because there's some of you on this call today who really like what you're seeing, but you're not really sure if it's time for Medicare for you yet, here's what I would tell you to do. Also on this page, you should see something that says schedule a quick phone call. And if you click on that button, you're going to be taken to an online calendar of ours, and you're going to be able to select a 15 or 20 minute slot that you can have a phone call with one of us, and we'll walk through your situation very easily and very quickly to determine, hey, is Medicare something you should do now, or is it something you should do down the road?
Yeah, Josh, let me just interrupt quickly. I actually had two of these today. Had two different families that were considering going on Medicare. And the situation is a little bit different, but one of them was the man was going to continue to work, and his wife was Medicare eligible, and they were just trying to compare to see if it would be best for them to have her go on Medicare and say no to the company plan. And after we did the analysis, I told them no. It was in her best interest to stay on that company plan and not take Medicare at this time. And the other situation was also very similar. It was just not in their best interest at this time to go on Medicare. And so, folks, we are happy to do that. In fact, honestly, the lady said, well, I appreciate your honesty and tell me I shouldn't take Medicare yet. And we will always do that. We're happy to evaluate your situation. All I need to know is what's it cost you for your coverage. I want to know your deductible. I want to know what your coinsurance is, what your max out-of-pocket is. We need to evaluate your medications. And just within about 15 or 20 minutes, we'll be able to determine whether it's time for you to go on Medicare or not. And so please, if you want to schedule one of those quick phone calls, happy to go through that, make that assessment, and answer any questions you have during that quick phone call.
So if you want us to help you, go ahead, click Get Started to begin. Now, for those of you who are on this, I want to offer you a couple bonus things just to maybe sweeten the deal. So here's what I'm going to do. I'm going to send you, if you go ahead, this is for the first 20 people who sign up, I'm going to send you a PDF guidebook that we wrote called How to Navigate Medicare.gov Like a Pro, because year after year after year, you're going to need to make sure that you're on the right drug plan. And so I want you to be able to have this and use this for the rest of your life, really, because it's going to help you save hundreds, if not thousands of dollars a year, and really you'll be able to navigate Medicare.gov just like our professional team does. It's very simple. So I want to send that to you for the first 20 people who sign up. The second bonus on here is for the first 5 people only. What I'm going to do is I'm going to give you a private members-only email address that you're going to be able to email any questions that you have, and you're guaranteed to have a response back within 24 hours. We usually say between 4 and 24 hours. It's a lot closer to 4 generally, but we're going to give you access to this so that you can have access to us. So for the first 5 people who sign up for this, we have people paying $39 a month for this. Well, you're not going to have to do that. You're going to get this for free, okay? Let me go over this, a timeline, just one more time. This is what it would look like to work with us. First off, once you click Get Started, in about 1 business day, you're going to get a call from our office manager, and she's going to call you and she's going to book your free Medicare consultation. While she's on that call, she's also going to send you a link that you're going to be able to go into an online HIPAA-compliant form and input all of the information that we talked about: drugs, doctors, hospitals, pharmacies, all of that information. So usually people take 2 or 3 days to compile that, and then once they do, they've compiled that info and they submit what we call the information form, and that gets sent off to our research team. Our research team takes between 3 to 5 business days to put all of your plan options together. Okay? They spend a lot of time going over this. Hey, they'll call your doctors if they need to find out and just double check to make sure that doctor's on the plan. Sometime after all that is done, somewhere around 3 to 5 days is what it takes them, you can now have your sit-down consultation with one of the Medicare experts on our team and go over all of those options. Okay, if you find something that works well, if you've decided, hey, it's the right thing for me to do, then we can do the enrollments, and then after about 2 or 3 weeks, you'll receive your Medicare and your insurance cards. All of this will be done in a very timely manner to ensure that there's no gaps in coverage, that there's no penalties that you have to pay. Very smoothly, very seamlessly, and hopefully as hassle-free as can be.
So basically, Josh, what you're saying is that when someone decides to get started and to click on that button and to begin working with us within 1 week, they will have met by phone or in person with one of our agents, one of our consultants, and then within 2 to 3 weeks after that, they'll have their cards in place. They'll be enrolled in Medicare. They'll have their A and B card. They'll have their insurance cards, and they'll be ready for their coverage.
Exactly right. And hey, if you guys say, I'm not probably retiring for 6 months, well, you can go ahead and click get started, and we'll just kind of push this stuff off a little bit. We can get an appointment set up for 2 or 3 months down the road, give you some time to put everything together. And so don't feel like it has to be done within a week or 2 weeks. We will work within your schedule to find something that's right for you, but we can do it very quickly because, hey, we've done it thousands and thousands of times. So if you want us to help you, if you want to work with us, go ahead and click Get Started to begin. And I just want to say thank you. This webinar took quite a bit of time out of your day, I'm sure, but hopefully it was helpful. So just thank you for being here, and hey, I hope we get to work with you in the future.
Yeah, Josh, let me just add this as well, folks. It is always a privilege for us to be able to educate people about Medicare. And this truly is one of the larger decisions you're going to make here for your retirement planning. And we don't want you to make a mistake, and you really don't have to. And so our goal is to make sure that you are not forced into or coerced into taking some kind of plan that really is not fit for you. Sad to say, many agents will do that. And our style is different. We want to give you the time it takes and educate you so that you are very clear as to what your options are, so that when you select that plan, it will be the right plan that will give you coverage for the rest of your life. And then for us, we know that this will be an ongoing relationship, and we want to be here for you, to help you and to assist you really throughout your lifetime as you're on Medicare. So again, it has been a privilege to be with you today. I appreciate very much you taking the time to be with us. Thank you.